and the drugs are released to patients on prescription and paid for upon use. But when the drugs are expiring, the manufacturers bear the responsibility of withdrawing their own drugs, and the hospitals do not suffer over expiry. Mr. Speaker, I'll go to my question because I see a level of impatience on your part on this matter. Mr. Speaker, I want to ask the Cabinet Secretary. Question number one. How much money in terms of contributions was in the accounts of the National Health Insurance Fund at the time of transition to Social Health Insurance Fund, chief? And could the Cabinet Secretary state the banks and bank accounts which the money held? Question number two. Has the money been fully transferred to authority accounts? If so, would the Cabinet Secretary state the banks and bank accounts money has now been deposited? How much money collected from contributors since the advent of, and could the Cabinet Secretary state how much has benefit of beneficiary, other eligible? Last question. What measures are in place to ensure that the money is not misapplied and the contributors are not denied?
Act number Honorable regards to the commencement of the Act mark the beginning NHIF to Social Health Authority for a period of 1 year. Act 1 year transition period. NHIF services on behalf of the as per the NHIF Act up until 30th. 1st October, that took over. However, all the pensions are still being paid under the monies in the NHIF bank accounts are being claims and other payments incurred by fund paid NHIF claims are shown as totaling to 8. These claims payable amounting to 24 billion as of 25th February 2025. Hospital claims, the Mama capitation life. Balances in NHIF bank accounts are as follows, totaling 11. The management froze all the NHIF collections accounts in the month of November 2020. Ensure seamless transition of collection to the chief account. SHA is now in the process of closing the accounts except for one that management has resolved to maintain for collection of NHIF late contributions from employers and government institutions paying NHIF debt, such as civil servant medical scheme arrears, as well as receiving penalties. Regarding Part C of the question, Honorable members, Chief was rolled out on 1st October 2020 to receive contributions and provide medical services as per the SHA Act. SHA management open bank accounts as per their approved by the board and the National Treasury. And the table, as you can see, shows the breakdown of contributions received under Social Health Insurance Fund as of 31st January 2025, 20.9 billion. And you can see the breakdown from. Regarding the claims, the total claims paid to date are 18.2 billion, out of which 16.9 relates to Social Health Insurance Fund claims and 1.3 relates to the primary health care capitation and is also shown in the measures that are in place to ensure that the money is not misappropriated and the contributors, their beneficiary, and all Kenyans are not denied access to health care. Honorable Speaker, honorable members, the management has instituted proper internal controls to safeguard members' contributions by ensuring, first of all, that the development and implementation of a new system for the purposes of SHA is operational. Secondly, the opening of designated bank accounts handling Social Health Insurance Fund, primary health care and emergency funds, as well as SHA operations. Thirdly, implementation of Section 42 SHA Act that restricts SHA administration expenses at 5% of the collection. And fourthly, implementation of a standard benefit package and tariffs, thereby removing subjectivity in payments while ensuring predictability. Again, data cleaning through fresh registration, generate accuracy of beneficiary data has been done and is ongoing. The PHC and ECCIF, that is the primary health care and emergency chronic critical illness funds, are exchequer funded and thereby accessed upon registration, while the Social Health Insurance Fund benefits are available upon payment 5%. Fund under the first schedule of the Social Health Insurance Act, Transitional Provision 5.1, states that the fund shall not provide enhanced benefit schemes and packages, insulates against the losses
Table. Have copy. The Speaker, I will, that's because I've just now, because you have said there will be engagements going into the future. Perhaps you can like that. We'll go straight to my questions. Madam CS, my appreciation of SHA, Kenyan now, not even Kenyan, is that what your ministry is doing, trying to climb a tree top, honest and shift. Why? Because under universal healthcare, not a Kenyan program, it's a global universal concept, supposed to facilitate access to affordable, promotive, preventive, curative, rehabilitative, and palliative care patients when they need it. That to happen, two things are important. Infrastructure development, in terms of just physical facilities and equipment within those facilities. Infrastructure, and one, personnel. Doctors, nurses, clinicians, support staff. Make sure then that forms the basis of rolling out. Madam CS, why don't you tell us and tell this country of those two important facets, what did the government do for rolling out SHA to ensure that we have, one, enough facilities, infrastructure, two, we have sufficient personnel to deal with the demands that come with. Secondly, my second, it's a live matter. You and I and Kenyans are aware that private and faith health facilities I saw yesterday that there are only 300 facilities. Yeah? You and I know that those only 300 facilities could be only facilities available to Kenyans, especially in far-to-reach areas. So the withdrawal of services by those facilities is actually a death sentence to millions of Kenyans. That statement coming from you, expected joinder from you immediately. Say that you care. Madam Speaker, Madam CS, what are you doing? Confidence. Faith-based private health facilities, make sure they come back on board and continue to offer services. Kenyans especially, far-to-reach areas.
Accessibility critical. This universal health coverage country type has been part of the had multiple guidelines from various bodies in terms of implementing universal health coverage. So this is something that and the bench. What we review, data, publication, such, other implementations, best practices, various countries in Thailand, how they were able to UHC a success country. So for us, it's critical. Even as you look, various countries, you observe that they raise concerns and grievances, first of all, on waiting time, second, on systemic system interruptions. So this is a common issue. But one thing that cuts across when it comes to UHC implementation, not all the countries that have implemented it is better than nothing, because they know that if each and every one of them can access services, then the country will move forward and we will not have a catastrophic expenditure when it comes to health service delivery for our people. So indeed, it is critical for us to really, as a country, and ensure that we are all in the same. That's why, again, really emphasize collaboration, Senate, and among other stakeholders to ensure that it is. And so we take note of infrastructure and notice that part of our pillar is the have the NEST project, National Equipment Service Product, where we've had multiple counties, sign the agreement. Again, that is around 45 out of the 45 have signed the agreement. 36, again, who have listed down the equipments that they need within. So it is an area that will. Now you will also observe that within our country, what we are seeing is we are building cells, we are building structures, infrastructure, but we don't have the services needed. We don't have human resource, we don't have health products. So again, we really need to balance, and that's why as a ministry, went back and reviewed what is critical to ensure that human resources are there, to ensure that health products are there for the patient. Those are really the critical components. That's why we really need some time to comprehensive and see how we are working together with KEMSA to ensure that there's recapitalization and ensure that medicines are reaching, or the commodities are reaching to the last mile, because that has been a challenge, especially in level 2 and 3, the dispensaries and health centers, where you observe that there is no medicine, and now people are moving to higher levels of care where they say their equipment products, and again, that brings a lot of challenges because food. But when we have our health centers and our health centers, and we have dispensaries having human resource, having medications, that way people can be able to access services, and that's why we support even. And so with regards to health products, we have a comprehensive report. For infrastructure and equipment, we have the National Equipment Service Program. And again, with regards to human resource for health, we are looking towards having more human resource for health within the program, and ensuring that we are running and supporting. So the personnel is not out of it. It's part of our action plan to ensure that the services. Again, we continue to support in the building of health centers as a country, and we continue again to ensure that they are functioning. You will notice even our annual plan and our budget are supporting in the development of health centers, but really emphasize not just a shell, it's not just a building. What we need is the services. Services to be there, we need health products, we need human resource, again, in that platform. So the private and faith-based organization, we do take note. We are acknowledge that they are really a critical pillar in ensuring that health services are delivered to all Kenyans. And so we continue our partnership with the private organizations, faith-based organizations. We have had routine them to ensure that they are supporting implementation of you. So what was critical with regards to the withdrawal of services was, so what we have done is, together with the social security team, having routine meetings, how we can have a payment plan for the NHIF debt. We are engaging Treasury. We are engaging various MDs that were involved for that there is payment that. So our engagement is ongoing. But as you can see, first of all, is that we are paying them on time. While we had talked about 90 days, we are actually paying them within 30 days. And when you engage them further, the problem is not social. We are ensuring that the payment is done within the time limits. The challenge was on the claims management, has been addressed currently. And again, challenge again that is really we are facing is the NHIF debt. So then once we have addressed that, I believe that a position to that UH. So NHIF debt was number one. Number two was the primary health care fund, which again they had not, some of them had grasped the concept of the global funding. And so what we have done is that we are meeting them to explain to them and really tabulate what it means to them in matters of the new form of the primary health care funding model, and what will actually of benefit to them. Because while previously in NHIF they were only covering around 7 to 8 million Kenyans, we are having universal, so we are having more Kenyans on board, so more services to Kenyans, and so more revenue collected in this. And so it's really explaining to them how the calculation is done for them to understand that they are not going to lose, they are getting even through this. And so we are reaching out to them to ensure that discussions are ongoing, and our partnership as the our partnership with the ministry and the private and faith-based organization continues, because we really need to have their services that they can access it. So we will honor the bill, we acknowledge, and we are having a payment plan for NHIF.
Honorable Speaker. I'm not certain any other response. The first one, Speaker, then the CS should just go on record. Senate, the law of the Senate, just go on record, say that we are not ready for, because in so many words, that's what you're saying. Saying you don't have infrastructure, you have personnel. Just go on record and say that as a country, we were not ready the rollout of. You cannot tell the sick nation that put money to build hospitals, you're looking to stuff. That should have happened before you rolled out UHC. So just go on record, be clear on that. On the issue of the faith-based facilities, Mr. Speaker, what baffles a lot of us is that this is already realized revenue. It is not money that, yes, if you listen. But now I'm asking her a question, she's talking.
Maybe if she is consulting, then you can suppose.
Maybe then that's a guidance you should give us, that while looking at her, that when we see her asking a question, otherwise, who are we addressing?
Maybe you can.
This is very interesting.
Answer the question.
The Speaker, let's just agree. This is a very about anyone. Mr. Speaker, on the issue of the private and faith-based, the CS has said that a plan. You know, I'm saying this is already realized revenue. It's not money that they are supposed to be going to look for and pay. Realized revenue. Speaker, let's sit down. What I want the CS, myself, and everyone in this house to realize that we can speak in the comfort of this city because we have hundreds of facilities around us here. The Speaker, in real Kenya, in the marginalized areas of Kenya, the faith-based organizations and private institutions are a lifeline for the people in areas. When those facilities are not offering services, then there is no UH that is taking place. The Speaker, I want the CS to real issues, not literature, Mr. Speaker. We are not talking about data, real issues. I expected her to tell us, Mr. Speaker, when we were closing down on NHIF to go to UHC, had X number of facilities. At the time of rolling out, we had increased the number from X to X plus 1,000. We had X number of doctors. We increased the number from X to X plus 20,000. Those are the figures that I expected, not literature, Mr. Speaker. Thank you.
Members? Yes, so UHC is a journey. Implementation of UHC is not a one-off, it is a journey. Right now, when you look at even countries like UK, which has been able to implement NHS, challenges are again.
You are listening to them.
You observe that the challenges are still present. They talk about human resource for health, and you can see even for us as a country, we are having our nurses and some people going there. So it is a journey, and we have to start somewhere. And our priority was to ensure that all Kenyans are registered. That way they can be able to access services. And so this is a priority as registration. Additionally, health financing, ensuring that contributions are coming up. With regards to the benefit package, we are having an advisory team that is meeting routinely to ensure that the package meets the needs of Kenya. And so what I really wanted to really highlight is for the human resource for health, again, it's a journey. Once we have our health financing, once our patients are being seen, once the products are reaching to the facility, then the resources continue to accrue, then we can have even more human resources coming in and again supporting us in the implementation of UHC. So we'll have a small proportion currently, but as we grow the UHC, as we improve accessibility to all Kenyans, and we have the facilities again accessible to all Kenyans, that way we'll be able to capacitate it. The country. And so I think it is critical that senators, even as we engage and have these innovative ideas, let us understand that the implementation of UHC will not be a one-off. It is indeed a journey. We have looked at best practices across, the globe, how they've been able to implement it within our limited resources. And our primary goal is to ensure that all Kenyans can access these very services that the rich or the employed are also accessing. And so for the faith-based organization, as I said, and the private institutions, this is a critical thing. We are talking to His Excellency the President. Again, we have talked to the Treasury, and now we are also requesting for your support, to ensure that we are paying the NHIF bill. So we are looking for the money to have a payment plan, and we will be paying the NHIF debt that is there so that our private institutions, our faith-based organizations can give the Kenyan people the services that they need. And this is really the critical thing that is being raised by the private and the faith-based.
Thank you very much, Speaker. Honorable Speaker, I think these are very important questions from Boa. I think the PS need really to understand entire countries, and she needs to answers because people are waiting these answers. Honorable Speaker, I want to request that the CS, if she's aware that, and I think the same thing, when Mheshimiwa Mandago was raising a questions on the debts that national government or KEMSA, another issue that has not been responded to. But nevertheless, I want to say, request the CS, if she's aware that civil servants are not getting treatment or denied treatment in private institutions, and now because it is because of the debts that the government owed through NHIF and SHA, if she's aware. Again, this has also translated to the injured police officers who have been injured while on duty, that they have a lot of debts that is accruing in NHIF for insurance company not paying the officers who have been injured while on duty. But the fact, the reason why I ask this question is if the CS understand that civil servants, police, teachers, and all civil servants are not giving or not getting treatment in private institutions because of the debts that are accruing, that has been there in NHIF, and you've shown how the figures has been given or has been transferred, and that transition is really bringing a lot of problems. So, Honorable Speaker, I want the CS to answer that question. Thank you.
That question, that's the
another answer, that is we acknowledge greatest concern that, and we as a ministry, how we can ensure that they acknowledge that.
Agnes,
my question is also on a different direction of human resource, as in the doctors. Most of our people go to hospitals in the dispensaries and level 2s and level 3s, where the people are working there cannot minister high blood pressure medication or those kinds of medication. So they are forced to go to level 4 hospitals or level 5, and they are not able to go there. What are you going to do about those dispensaries and level 2s so that we can have at least a doctor there who can tend to the old people in the villages who go to such hospitals for attention? Thank you.
So we have our blood pressure onwards. Yes, we acknowledge we don't have sufficient doctors in level, but we are working together with counties. Again, we've had best practices like rotations, levels of care, lower levels of care among the med. So yes, we acknowledge and have the blood pressure from.
CS, you have stated aptly affordable quality healthcare. Ideally, the main objective. A matter of had threatened provision, and we would like to know that threat was. Hope it was not. And we would want to know how the ministry has structured the claim of the 30 billion that Rufa is claiming. Have you arrived at any conclusion or negotiation, any mediation that could have settled that claim, which was incurred by the now defunct NHIF and which is being demanded from her? What measures have you taken to ensure services are not suspended for the ordinary?
kind almost want to get 5. That's not.
Thank you, Mr. Speaker. Mr. Speaker, the CS has told me that the high blood pressure and diabetes medication is in level 3. how will the people in the village know that that medication is in level 3? What are you doing in cooperation with the counties to make sure that the people know where they should be going? Because they go to the dispensaries, they go to level 2, and they are told we don't minister those kind of medications. Can there be a way of reaching out to Mwananchi to know where they should go for diabetes and high blood pressure and arthritis, because those are the sicknesses that are down at the ground?
Want to ask you a question?
Asante sana mstahiki Spika. Ningetaka kumuuliza waziri kama amesikia kilio cha walimu, masikitiko ya walimu, kwa walimu ambao walikatwa zile fedha lakini zikaenda kwa hazina kuu gari na haikufika azo wanafaa kwenda na mbando wako na kandarasi na bima zingine ambazo zinafaa kuwasaidia katika mambo ya matibabu. Kwa hivyo swali langu ni hilo kwamba kama ashajua na kama ashajua shida ziko na walimu, amefanya nini kuhakikisha kwamba amesuruhisha ili walimu waweze kupata? Asante sana.
Then I'll be transit to the question.
I'll start with the blood pressure. Adds to hypertension and other non-communicable and non-communicable. Have more than 100 health providers, health promoters who have been on the ICHIS platform, and they have been able to register more than 8 million Kenyans out of the 12.5 million households. And they've been able to revisit 7.3 million households, and they've been able to screen 28.2. They've been able to screen patients for diabetes and hypertension in these areas. So we've been able to screen Kenyans, 340 them who have been referred for diabetes, and 730,000 who have been referred who had hypertension. So the community health promoters are indeed a critical platform that we are utilizing in the community, educate on preventive, promotive healthcare, and then also to identify and refer these cases. Additionally, even for level 2, yes, we have human resource like the nurses there who are able to identify the patients who have hypertension and refer them to higher levels of care. And so we continue with training and capacity building, mentorship and supportive supervision for our CHPs, our healthcare workers, to ensure that they are identifying. And indeed, they have been a critical pillar and a game changer with regards to identifying conditions that were once affecting our. So again, just to emphasize on the NHIF debt, we are acknowledging the debt is there, and we are again looking at the payment plan. And really this is the main concern with the private and faith-based. So what we have requested is that they submit all pending claims for verification, then payment will follow. And so maybe even to give you a background, there was a press release yesterday by the SHA team, and what you can see, there's a lot of effort going towards payment. Social health insurance fund, we've been able to pay 5.1 billion. And the concern they have is not social health authority. It is indeed NHIF pending bill. For SHA, we've been able to pay most of the time within 30 days, and the ones that were not paid were maybe the claims of which they are reviewing, and quite a good proportion has been paid. We are also having transparency and visibility and really engaging them to ensure that this continues with regards to claims, where they are and how we are progressing forward. So instead of 90 days, we are actually paying within 30 days, and we are pushing for the acceptance of. But for the NHIF, again, we acknowledge and we are looking for the resolution process in this regards. Teachers, like any Kenyans, have been able to pay the premiums that are entitled, so they are able to access the SHA benefits that have been given to them. Again, teachers employ the TSC, they use their private medical insurance paid by the TSC. At times they mix SHA and TSC medical. So this is a different scheme paid by the TSC, not SHA. But with regards to SHA, after registering and after paying their contributions, they are able to access services under SHA. And maybe also to emphasize, at times, the employers say they have paid, but they have not. So again, we are brought on that we are not SHA services, yet the concern is on the employer side. So we are also emphasizing and negotiating and ensuring that the employers remit. That way we can improve the noise that is out there.
Thank you, Mr. Speaker. Mr. Speaker, I dictated us a question. Pending bills. Quick reference. Faith-based hospitals. I wish to urge the minister perhaps separate between private facilities and faith-based hospitals. Because I know for a fact that some of these private facilities, if you look at the debt burden, is mostly heavy on the faith-based facilities, for reasons that every Kenyan knows. That it is difficult for any faith-based, some of the things that private facilities are able to do, get their payment faster. And perhaps that matter needs to be treated with more urgency, Mrs. However, because I've gotten the mic, I want to register my comments alongside that of the Health Committee, that I am terribly disappointed by the conduct of this, led by the Health Minister, together with her two PS. They have treated this House with serious contempt, and that is not that I take lightly as majority. The fact that they missed our midterm review meeting, Mr. Speaker. The cabinet minister says she was in cabinet. What about her two PSs? Where was Harry? Where was PS Mudhoni? Couldn't they find their way to Naivasha? How can you continue to interact with colleagues whose only interest with health matters is a budget allocation to your ministry? All policy-related matters are implemented at the county governments, Mr. Speaker. You can hear the kind of questions that senators are asking. Some of them is purely on account of the fact that this ministry has failed to interact with this House in the manner that it ought to be, Mr. Speaker. If there is a big failure, Cabinet Secretary, that I want you to register as you leave this House, forget about Chief and SHA, much as those are very important issues, is the fact that you have not been able to lead your ministry to have a serious engagement with the Senate of the Republic of Kenya. And for that, I hold no other person responsible other than you, Madam Minister. And that is not something that is acceptable to us. Therefore, Mr. Speaker, I want to agree with your finding that when the minister returns to her office, can she find the time to come and provide an update on all the issues that she had been requested to come and present before a midterm review meeting, and ask for a time that we avail? This House is available on Tuesday mornings and Thursday mornings. Can she pick a day in the next 2 days if she wants to restore normal relations between us and the Ministry of Health, Mr. Speaker? Otherwise, I am terribly disappointed, Madam Minister. And PS Harry knows this, PS Mudhoni, you know this. You are my good friends, but you have let your boss down. You need to work better with a House. We passed those four laws, Mr. Speaker, knowing that SHA was going to be transformational and change the lives of Kenyans. Do not sit in your office, Madam Minister, and listen to your choir of office officials. Come and listen to the representatives of the people to tell you the challenges that people are facing. I rest my case, Mr. Speaker.
Now, Majority Leader, go and navigate in that guidance, but and a lot of business actually build at night at midnight. At every take time to read. The Senate is house of research that you can other people. Most of the health issues, sometimes what is happening, don't spend your time chasing for money in the National Assembly. After you chase your money, then come back for policy. You can see the rest is almost and that is dialogue with you. As I put it, spend your time we are time you came to the National Assembly, time even to us. At the tent there was not in. I have many questions that I'm chairing actually come and deal with it. So as I guided senators, let me get 3 more and then we move to the other question. Senator Koiti, Tata.
Mr. Speaker, sir, thank you for this opportunity. Address the Minister of Health.
Supplementary question.
Yes, I'm asking a supplementary question. Addressing her. My question is, Cabinet Secretary, conceptually speaking, how do you reconcile universal health care and the practice of paying premiums? Paying premiums means that you have capacity. It also means nobody is left behind. Paying premium means only those who are able to come on board. So how does it become universal health care when people have to pay premium to access service? Of course, we are trying to invent the wheel in Kenya. There's absolutely no country in the world where universal health care is funded through, usually funded by main taxes, and Kenya is a signatory to the Abuja Declaration of 2001. When did we move away from Abuja to SHA? That's the question I want you to answer. Reconcile. Philosophical contradiction. We are visiting upon this country by using stock phrases like also health care.
Thank you, Mr. Speaker, sir, in answering. I think what Majority Leader forgot is that the ministry has also left the press. He explained the issues. Them communicate can't even. So I hope you take those notes and take it as a come out and explain and answer questions. So, Madam Minister, we can cut some slack because you just came in, but you must pull up your socks. Finally, Mr. Speaker, sir, There is this story, Madam Minister, can you put it to rest, about baby Ariana Wairimu? Allegations as that she had a bill of 1.6, but SHA only paid 23,000. What is the proportion in line of what Senator Wambua was asking in terms of payment in proportion of the bill that the hospital? So the case, you can use the case of baby Ariana Wairimu, where that 23,000 only was paid against 1.6 million bill, and confirm to the nation in the same line whether all funds under SHIF fund, critical care fund, and primary health care fund, are those three funds under SHA and SHIF, under Social Health Authority, functional at the moment, Madam Minister, and confirm to the country that whether these three type of funds are functional and Kenyans can access. If they are not functional, just be honest and tell us either one or two are functional. I thank you, Mr. Speaker, sir.
Then, as we must move to the
Honorable Speaker, it's not every day I stand up and say that the majority. But this is one of those days, and always suspected that the majority leader is a good man, because whenever we come to critical junctures where we have to cross ranks and say something is working, it's working, if it's not working, it's not working, he has always done so. And that is the thing for him. Honorable Speaker, and Madam CS, your president, the president, I heard him yesterday saying he pays 50,000 Kenya shillings. Sir, I very painfully pay an average of 32,000 Kenya shillings every month to SHA. And I say painfully because majority all that when that bill was here, I proposed an amendment to cap that contribution at 5,000. Unfortunately, that time, when a majority leader, you are not as good as you are this morning. You allowed the you voted to defeat that amendment, Honorable Speaker. But I want to cut through the noise, because here in Nairobi, Honorable Speaker, you know they say, hatutaki mambo ya kizungu mingi. Now that the president told us that if we remove that capping, that if all of us pay according to our abilities, we will end the specter of harambes to raise money for healthcare in this country. Can the cabinet secretary standing here before this day confirm to us that there is no family in this country that has planned a harambe for this weekend, get payment for a loved one in healthcare, including that baby Ariana? Can she confirm that to the country? And if she cannot confirm, then she should be gentle enough, she should be kind enough to tell today that this thing is not working, that we should go back to the wisdom of Sifuna when we were having this conversation. I thank you, Honorable.
Thank you very much. In fact, I just want that has been okay, and so is that the Minister of Health cannot say. Come, Honorable. Ariana suffered from person, and she is 10th world at that particular. So is the ministry. So and I've actually been using a case as a success. Person's disorder. Speaker, unfortunately, lost baby Ghana. A bill as it was by the first on 1.6. What SHA has paid now is 1,000, and therefore, can't we use then this case gauge whether SHA is working on working? 1,000 out of 1.6, that's just a negligible percentage on it. And you cannot keep things. What we have put as money, this and the number of patients that have been taken care of. First, on this very specific case that you must be aware of, because disorder, you must be very aware of baby Ariana. That's why SHA has paid 20. First, confirm whether SHA has paid 20,000, and the secondary, that's why SHA can pay 20 out of a bill of 1.6.
Very well, Cabinet Secretary.
Regarding previously under NH tax funded, capturing the fourth sector, 20% under this health insurance. And so when we talk about behind IF was living up to it, cover each Kenyan health service delivery. So when we come to SHA, we see that it is we are trying to ensure that all Kenyans are on board, all their health needs are addressed, and part of it, social health financing, ensuring that 5% of amount is being deducted for contribution. Ultimately, that we are leaving behind. But equally, you take note that the indigents will be covered by government. That is, the people who are unable or capacitated well to cover, pay the premiums. As again, a government which is able to support again health insurance coverage. So I think this is a great step from the 20% and then now ensuring that all are being covered. You can see that we have now increased, the population is now up almost 3 times the population that was covered previously. So great progress when, Senator, there's great progress. Talk about the number of people that have registered, the number of people that can access primary health care. We are having up to 3 times more that can be. Then when we come to registration and access services in higher levels of care, we are looking to ensure that the contribution, ultimately, all Kenyans will be able to. I believe that this is a game changer where we will have Kenyans not selling their property in access. Additionally, they are very good, and I can attest, and next time we can have a report, more than 500,000 services, can tabulate how much contribution they have to pay, how much was covering. That way we'll have evidence-based and data-driven analysis to show you that indeed SHA is working. And when we talk about maybe Ariana, yes, the ministry acknowledges, and indeed we send our condolences to the family. Again, that was a challenge. Seeing Pearson's syndrome is really very rare disease. Only 10 people have. So as a ministry, we are looking at ways of ensuring that we are reviewing diagnosis, the treatment, management, etc. But when it comes to the management, maybe notice that NHIF cover previously was 4,600 for ICU. But I can assure you that the ministry has really been advocating, pushing to ensure that our ECCIF, that's Emergency Chronic Critical Illness Fund, and right now we are happy to say that after reviewing, it has been increased to 28,000 Kenya shillings, and that way gradually will improve. We have the benefits package advisory team, and this team will be reviewing the benefit package and seeing gradually how we can improve, ensure that Kenyans are accessing services. As you are well aware, at the beginning of UHC, what we looked at the burden of disease in Kenya, and then we also looked at what was causing death, causing catastrophe, and also reviewing what NHIF was offering and the benefit is actually better or same as NHIF. Nothing is lower than what NHIF is offering. But moving forward, based on the resources at hand, hope to gradually improve the benefit package for the betterment of health services for
Yes, Senator Methu.
I don't know why the yes for health. Now that you admit of Ghana, Darwa, come to persons 1,600 out of a bill, 3,000, sorry, and 620 out of a 1.6. That was a very hard question. First, ask whether it's actually a fact that Shah paid 2,000. Then we shall get to the second. Why would he be working? He has paid such a negligible amount of money out of a bill of 1.6. And maybe finally, because I have been very, very parents of these particular kids. I know that Lewis, the father, the family and his friends have on their own, out of their own contribution, spent more than 10 million that baby to eat. And the government had not paid anything. Only one last time that Ghana won, one that has been very working. Only one time that come because out of the many I've had, there was no way the government of Kenya. So, Madam CS tell us that I paid 20,000 for baby. Don't tell us stories. I worked where, and you say that you are aware of it.
Yes.
Madam, the truth. No, this is a premium platform. What we are seeing in social media, you should put it place before where you are having a forum. We are asking a simple question. Rihanna had a of 1.6. There is allegation that 20,000 has have all officers around you. Why don't you consult so that you don't use social media hype to confirm that SHA is not working? And then finally, to the Speaker, sir, but the Minister, just be specific. Are these funds under social working? Because in your answer, you have only said about the claims of chief, and you have said nothing about the other two. Can you just confirm before the nation? If you do not have the answer at the moment, just ask for more time so that you can bring. Because as legislators, we don't want to join the rest of choir people who are saying SHA is not working. We want to protect your job.
Honorable Speaker, mine is
Senator Onyonka.
Mr. Speaker, well, I want to say thank you for giving me this opportunity. What I would want and I would pray for before I make my contribution. Speaker, the majority leader has pronounced himself. I believe that this discussion that we are having in this house is an exercise in futility. Because the questions we have are close to 30. Like I've not even asked her who are the owners of the financial. She's insisting that the SHA and chief working. The reality is that everybody in our republic is talking about how that system doesn't work. In fact, I even want her to explain to me why NHIF was removed from providing the basic services. We knew that NHIF had issues of corruption and mismanagement in terms of the payments which were being, we knew all that. But you see, Mr. Speaker, what has happened is I see the CS really struggling. Can I make a special request here? Because I had the majority make a contribution. Did Speaker who left before came in did not pronounce himself what we need to do. I believe that this matter cannot be interrogated on the House. Maybe we need to have it in committee so that we can spend even a whole day, run through the figures, ask those questions, because everything I hear here, Mr. Speaker, like this whole exercise, just a confusion and a rearrangement of things which I don't even understand. And Speaker, I'm not very literate. I'm averagely somebody who's... So can we, as a Senate, ask the CS that she can go and prepare herself, so that she can bring the... We go through this with a truth bomb, so that once and for all, we may be able to decide, is it working or it's not? If it's not working, we go back to NHIF and fix it, that it continues working, because NHIF was doing better than what is happening right now. Thank you, Mr. Speaker.
I will. And if I told you matters, have time with the... In fact, I had even offered that we shall... Senator Manda shall mobilize but unfortunately that has not been done. Just a quick, Madam Waziri, the stand of the private and government, I mean, the right now, they're being in a way that they have been plagued with Waziri, forcing providers to revert back to the... And also your... And the success rate for patients verification are still there, Madam. So kindly just address the standoff between private hospital and government hospital for the date of how you're planning to resolve.
Oh, thank you, Mr. Speaker. I in my majority. By health is devolved. I only hope and pray that that is not bearing ground for laying off some people. But coming to my question, especially regarding from Darwa, I would like the House, Mr. What is for patients? The medication is not available locally. Disease, not just which is a rare disease. It is not locally, and where aid is. There are very many and high taxes charged by the government. What exactly of the disease, especially those locally and are doing about the same reference. Thank you, Mr. Speaker.
Correct. Here before, engage on and whether I would actually feel the CEO of SHA at the gallery when the CS is responding to questions about SHA. That goes in the speaker to show the contempt. If that is the case,
Owned by
that's the case. Terrible. Let's arrange to have a committee of the whole that we engage.
very well, Senate. Very well, Wafula, I'll give you.
Thank you, Honorable. That important that
Senators,
Don't run away from the restaurant. I've been informed. Choices have consequences. Choices have consequences. CS must know who should sit next to her when she's responding to specific. You can never have a CS surrounded by other officials of the meeting. When the CEO of the that we are questioning seated in the gallery, the speaker, that is as simple as it gets. Chairs could have been occupied by first the CEO of SHA and then the rest of the officials. For the rest of it. Thank you for the information.
Senators, we have to. Then we proceed.
Has not. Thank you. And
Order, honorable senators, order. Ask the question. Please pay attention. Senator Mandago, Senator Wafula.
A whole day session. That way we can flesh out, identify where we can work together. As I said earlier, collaborate, work together so that we can have being a success, UHC success. I appreciate the comments and we look forward. My team and I will be giving a date and possibly just to engage at your own when we can discuss, deliberate further so that we can.
Thank you, Cabinet Secretary. I think, Cabinet Secretary, you made quite a number of commitments to this House. We would expect you to provide a written response to all the matters raised by the senators once you do not have adequate to. And also, you had made a commitment to provide a report, EMSA, the other report that you've committed to give it in 1 week. Let us, Honorable Senator, question by Senator Hamida.
Speaker, my questions, Madam, was as follows. Number one, have medical their monthly stipend up to date, and if not, explain the delay and state when the government will streamline guarantee timely payments. Number 2, what is the ministry doing to the working conditions for medical interns currently handle workloads and work for extremely long hours under intense psychological? Number 3, the Cabinet Secretary provide an overview of the support systems and programs currently being by government to address the physical and mental well-being medical. Number 4, the Cabinet Secretary also explain what government is doing to ensure that the mentorship program of medical effectively integrates both professional development and. Thank you, Mr. Speaker.
And members of the national year 2020 ministry as per matrix law at a cost 8 12 months, but there was no budgetary allocation cohort that was to be January 2020, and this consequently National Treasury did our letter reference MOH budget 150 12 September for additional funding to of the aforementioned second cohort. National Treasury with their letter press 1083 1A 9th October funding could not be availed following the end of the industrial action by Kenya Medical Pharmacy and Dentist, culminated in the signing of the return to work formula 8th May 2024. Parties engaged in negotiations matter of negotiations resulted in an agreement to post the interns with effect 1st August 2020. Further negotiations on the payment of interns, so the parties expect payment as per CBA 20. Regards to the government's effort to streamline the process and ensure timely payment, the ministry has formally engaged the National Treasury to facilitate the prompt and adequate funds to support. And the ministry is working closely with stakeholders to establish a clear, agreed framework, the posting of interns and the modalities of engagement, ensuring efficient. Regarding what the ministry is working on, Honorable Speaker and members, the Ministry of Health is working with AMPDC, and it has implemented a range of policy and regulatory to safeguard the mental health, well-being, and overall welfare of medical, particularly medical, taking note of the strenuous nature of their learning content. The key measures undertaken in centers to appoint dedicated personnel responsible for conducting regular mental health training and ensuring access to qualified mental health. These professionals provide essential guidance, training, and psychological support, fostering a healthier work environment. It has greatly improved mental health awareness among healthcare providers and the broad, reinforcing the importance of well-being, high pressure. Furthermore, mental health play a vital role in supporting, offering timely intervention and address emerging concerns. To enhance coordinations, these professionals have been working closely with KMPDC in managing cases that require specialized mental health. Secondly, there is enhancement of welfare and support mechanism. All healthcare institutions are mandated to establish comprehensive welfare programs, including structured mentorship work, chaplaincy services, and peer support structures. These measures aim to create a conducive work environment where medical personnel may freely express professional concerns without fear of victimization, reprisal, or prejudice. Thirdly, regulation of workload and rest periods, strict adherence to the Employment Act 2007, Occupational Safety and Health Act 2007, and other applicable labor and medical internship regulations. Ministry and KMP require all health facilities monitor and regulate intern hours. These are designed to prevent workload and mitigate burnout. Through these initiatives, the Ministry reaffirms its commitment to safeguarding the psychological well-being of interns, ensuring they receive necessary support to navigate the demands of their actively. Part C, where you ask for us to provide an overview, support system, and the program currently being government to address the physical and well-being of interns. Honorable members, Ministry of Health in Kenya has implemented several initiatives to support the physical and mental well-being of interns. First of all, developed the national guidelines on workplace wellness. That was in October 2024. These guidelines aim to well-being and establish a system for employees and health professionals in training medical interns face challenges. Ministry advocates for mental health. Workplaces calling for the united effort, urging investments across hospitals. They're implementing guidelines by mental wellness program. Secondly, integration of mental health into primary care. Acknowledging shortage of mental health professions, the has taken active steps services into primary health care. Strategy enhances access to mental health support, ensuring that medical interns can receive timely intervention in health care. By embedding health services into primary care, Ministry is equipping frontline healthcare providers with identify, assess, and manage common conditions. This approach early detection, burden of specialized mental health, medical interns in particular, as they receive both training and direct support, recognizing and addressing challenges. More supportive and responsive healthcare environment, promoting. Additionally, the working to collaboration between mental health professionals and private providers, less referral and thirdly, clinical guidelines for mental disease. 2020 launched Kenya's first clinical guidelines for mental guidelines along with the mental gap action program. It aimed to improve identification, diagnosis, and management of mental health conditions, thereby enhancing what available to. In addition, the guidelines for the management of common disorders, along with the Kenya adapted version of the World Health Organization Mental Health Gap Action Program, aim to close 75% gap by improving patient diagnosis, management of mental disorder, primary care. They include comprehensive strategies, diagnosis, treatment, and referral of clients, including medical interns. Oversight and regulation, the KMPDC, in collaboration with the Ministry of Health, is responsible for enforcing clear guidelines on working conditions. This oversight ensures compliance and accountability across healthcare facilities, aiming to improve working environment. These initiatives reflect the government's enhancing the physical, mental well-being interns, intensives. Regarding what the government is doing to ensure the program of the medical interns is effective, both professional development. Honorable Speaker and members, Ministry of Health has undertaken several initiatives to mentorship programs by integrating professional development and emotional support. Recognizing the demanding nature of medical training, aim to create well-rounded support that fosters both clinical competence and mental well-being. A key component of this approach is collaboration with KMPDC to strengthen mentorship partnership structured mentorship programs have been designed to provide guidance on career, ethical practice, and professional development, while also addressing challenges faced. Initiatives in training of internship coordinators and advisors, where the Ministry and KMPDC have instituted mandatory training programs for internship coordinators and supervisors across all accredited programs are designed to equip mentors with the necessary skills to provide structured guidance, supervision, and psychosocial medical. Secondly, oversight through the Fitness Practice Committee. Fitness to Practice Committee of plays a pivotal role in monitoring and evaluating the ethical conduct of medicine. Through this framework, Council maintains a structured follow-up mechanism that extends beyond the internship program, ensuring that medical practitioners continue professional oversight and mentorship as they progress. Measures are part of a broader strategy aimed at strengthening internship training, fostering a supportive learning environment, and enhancing the overall quality of and professional practice. The Ministry remains steadfast in commitment to upholding high standards of mentorship in line with statutory. Thirdly, national guidelines for internship training. KMPDC has developed comprehensive guidelines for internship training. Guidelines emphasize the importance of mentorship in fostering professional growth, ensuring the well-being. They outline the competence and skills required during the internship period, providing a structured framework for both professional and personal development. Through this initiative, the Ministry aims to provide a holistic mentorship, integrating professional, psychosocial, to their well-being, effectiveness.
Just a quick. CS, by the time the interns would have lost hope, and you know what it is with them. And I'm just wondering, does SHA cover psychological therapy? That's what they require now. And we don't want to lose any more lives. They're still claiming they sleep hungry, they have no hope.
Secretary?
Honorable Speaker, one of the great achievements we have under the social coverage of mental health, and we are happy to under SHA, the medical services, substance.
Anna?
First of all, I want to appreciate must give because following the statement time late last year, I had a very proactive cabinet. My entire team, cancer, National Cancer Center, screening, exercise. I truly appreciate it. But I think next time, involve political or grassroots leaders that they can mobilize the community. Counties people are scarcely populated, and we needed travel. I know you are very surprised because town centers like Wamba and Maralal was having a low turnout because you didn't mobilize in time. So I hope you exercise, as you have seen that it's a disaster. Secondly, I appreciate you for launching the oncology center in Samburu County. I couldn't. And we are very proud as the oversight body when we see us in the executive taking very active. And we hope with the same breath that that girl child is not. In my supplementary question, I would like to know if there are any measures you're taking towards ensuring that mental health is addressed among the youth. So very well that the people I represent are the population that is largely affected by mental health. And there was a statement I did requesting the ministry to ensure that we have mental health desks in all public health and hospitals to ensure that at least something called mental health, and they can walk into a health facility and seek mental health services just like they seek help for other illness or ailment. Lastly, I would like to know from the Cabinet Secretary.
Senator, you're only allowed once. But only one question. I also gave you sort of lead story. We allow other senators to ask a question.
Thank you, Mr. Speaker. It's important to show gratitude that Kenya got step and critique. But I beg you to just ask this question.
Very well, very quickly, please.
I would like to know if for public health facilities have proper hygiene. The ministry working in collaboration with other organizations or have any programs to ensure that water is provided in public health?
Senator Mohammed Tute.
Very much. Let me thank the Times. If she has thought of training.
Senator,
yes.
Senator Chute,
okay.
Ask your question related to the principal question that was raised by Senator Hamida and stick to the question only, please.
Honorable Speaker, related because of the pressure. Anyway, let me go. Honorable Speaker, the question I have, there is an outbreak. What action has he taken? Again, I have two patients, one in Nyeri, one in B. Family. Is paying head surgery. What happened? Somebody, the ICU, also other costs, doctor's cost, other related. How
Bindu?
Mine is just a confirmation, CS, Honorable CS. If SHA is covering mental health and drug abuse related issues, because that is very common in our villages. And these people pay for SHA, and I want to know if this is covered by SHA. Thank you.
allow the CS to answer those 3 questions and then take them. Yes.
For mental health among youth as a national, have been able to guidelines, strategies, and action plans rest only for the youth, but of course, said earlier, we have the national guideline on workplace wellness. We have, and we are working on health into the primary care, utilizing our interns, medical interns, and other healthcare professionals in order to identify mental earlier. Again, instituted. Equally, we have the clinical guidelines for mental disorder. That way, they can be implemented at county level. Have the oversight and something that we are working, elaborate, and also regarding the water sanitation, as well as county and stakeholders, that our health facilities, primary health care have wash component test, then have guidelines and assessment for healthcare facilities where we conduct to water sanitation up to capacity to avoid spread of infection. For Kalaza in Marsabit, yes, Kalaza is a neglected tropical by Leishmania parasite, and Marsabit has 19 cases. What we are doing is sensitizing the community on Kalaza and other forms, also having case management, focal points at Marsabit, at the hospital, in order to treat, also improve surveillance and detection cases, so that we can be able to regarding vector control is another area that we are looking at, as well as capacity building healthcare workers in matters. Also have medicine available. I believe that, as we had said earlier in the committee, we will be able to share a comprehensive report, which will also incorporate various benefit packages, as well as the improvement that has been done with regards to intensive care unit, that is the ICU, among others. Mental health and substance abuse, yes, we are happy to report that SHA actually covers, unlike NHS, mental health and substance abuse. And we are seeing many Kenyans taking up this service. And even when given the time, next time we'll have a comprehensive.
Kavindu, what's your point?
Chair, actually, Honorable CS has already answered that SHA covers. But sometimes when you are trying to interact and calling to get interventions for you, Honorable CS, we can't get through to you. Kindly answer our calls because we have issues. Like I had somebody who had died in KU from December and we needed your intervention, but we could not get you. Thank God for the CEO for SHA and the CEO KU, they intervened.
Thank you, Senator. What is your point of order?
Honorable Speaker. Yes, didn't tell us. How is she going to help us? Education-wise and all those. Most important thing, pension.
Thank you, Senator. Cabinet Secretary.
first of all, NHIF did not started and in October, ICU only. Currently, a lot is packaged. As to prevent, a lot has been done. We've guidelines for prevention and Azam have advocacy. They are utilizing the community supporters, and also knowing that health is are also working with the county government to preventive strategies such as vector control.
I'm aware that you put a request for a statement regarding that disease. Are you seeking to drop that statement so that you can get the answers right now from the CS? No, Senator Chute, I will not allow. No, Senator Chute, we will not dwell on your.
Let me answer that question, Honorable Speaker.
First of all, Senator Chute, I allowed you to ask the question. You did not ask a question related to questions raised by Senator. And you already have a request for a statement. So can we just agree that you're going to raise your statement and get the adequate answers at that time? Allow other senators to ask their questions. Senator Chute, Gay.
Thank you. Following up with the question of funds, asked in April 2020, at the height of COVID pandemic, 9,000 tons under universal health coverage were given contract for 3 years. In April, I think in 2020, the Speaker, the summit sat in Naivasha and extended 9,000. The Speaker that fought and assisted us to fight against COVID-20. My question, Madam Waziri, under Article 41 and Labor Relations Act, the labor laws of, what is the fate of universal health coverage of more than 9,000 interns that were hired under the ministry and in partnership with the county governments, because I'm aware health is devolved, and is this a silver bullet in finishing the many strikes that we know in Parliament of doctors, of nurses, of any kind of medical? Is the ministry in the process of transiting them to permanent and pensionable, because you are violating of Article 41 by having turns, being in turns for the last 6 years? Yeah, Madam Waziri, can you confirm to the House that there is a proper rollout on permanent and pensionable rollout with the Ministry of Health and also the county, so that we protect the young people, Mr. Speaker? So that's my question. Answer.
Thank you. Honorable Senators, Cabinet Secretary, indulgence, I pose that to allow the supplementary. Next question by Naga. Then we take all the supplementary. Order.
First, I need to highlight that actually there are 9,900 comprising of 16 cadres who were recruited on a 3-year contract in May 2020 under UHC. They were deployed across all counties and national government health where they were at a constant 1,040 a month for diploma and certificate respectively. Upon expiry, their contracts twice in 2020, May and expected, culminating that will come to close in May, allow time for finalization of their absorption counties where they work. Cost of translating them for permanent and pension 7.6 are working county how we can staff into. However, at the moment, have their contract and
you, Cabinet Secretary. Move to the next question, number 14 by Senator James Morango.
Thank you, Mr. Speaker. For my question, and I want to maybe to say that I am contented. Answer that I got from them. However, I'll just go ahead and read it. Question number 14. Will the Cabinet Secretary highlight the programs health sector that will be affected by the withdraw funding from aid-funded healthcare programs in the country, with particular focus on how such withdrawal affects them? But B, would the Cabinet Secretary provide a breakdown of the budget? C, what action the Cabinet Secretary taking to ensure that not stop but the counties and at the national?
Thank you.
Honorable Speaker, honorable members, the recent withdrawal of funding by the American government following 141.9 has had profound and far-reaching health programs in Kenya, abrupt shift services, ongoing initiatives, areas that rely heavily. The affected programs include HIV/AIDS program. Role of funding affects the provision of life-saving antiretroviral therapy. 1.4 Kenyans HIV country. Nyaga County alone, 12,300 HIV, 10,450 currently. Furthermore, critical lab commodities, early infant viral load testing are at risk of stockout, jeopardizing the timely detection of HIV. Again, the malaria control program, funding free control commodities across multiple act for including insecticide treated nets, rapid test kits, and preventive treatment setback. Area endemic regions, particularly in counties with high transmission. Without timely intervention and related rise, undermining progress. Family planning program, the withdrawal of funding has significantly impacted the essential family planning commodity. Stock levels of contraceptives, injected contraceptives, or pills have dropped below the required minimum. Public and private facilities shortage and families to access reliable maternal and child health outcomes, particularly in countries with high unmet control. vaccine funding has disrupted the affecting approximately 5% amounting to 580. Counties with large immunization coverage gaps such as Annam, West Pokot, Mandela, and this reduction in funding emerging public health threats potentially passing had won. Nyaga County 93% for pentavalent, 91% national coverage. Program role of funding has disrupted the life-saving nutrition. 5 counties with high rate of malnutrition. Marsabit are particularly affected. Thousands of vulnerable children health complaints. Without urgent intervention, deaths could be waiting already critical drought affected. Yagi County flagged nationally for overweight and obesity among the reproductive at 65%, highest in the country. Therefore, a target. Human resource for health, the funding freeze affects 40. The county has submitted a list of 150 frontline health staff are spread across LVC Health Association. Afia 4.7. But the services continue now. The Cabinet Secretary provide a breakdown of the budget for the programs. Honorable Speaker, honorable members, the total budget for the affected program in the 9.8, and the breakdown is actions taken to ensure that critical services under the affected that we avoid likelihood of healthcare in jeopardy, counties and the national. Honorable Speaker, honorable members, following measures to mitigate the funding with number 1, emergency funding. The ministry has requested emergency allocation of 33.5 billion funding gap and programs. The breakdown given below. Secondly, diplomatic engagement, where high-level bilateral discussions with the US government are going to clarify and implement services. It is, however, important for the Senate scenario support the ministry meet the budget gaps, resource allocation, affected programs at national and county. Reallocation of resources, the ministry prioritizing reallocation of domestic resources, sustain critical programs, including planning, as captured in the budget policy financial year 2020. Again, strengthening local systems where efforts are underway to strengthen domestic health financing mechanism, including social health insurance fund, reduce dependency on external donors. For example, premium insurance financing to net in formal sector economy. Commodity distribution, the ministry is engaging Global Fund to expedite the procurement of its Annex 3 status for ARVs and stock pipeline as provided. Data system integration plans are underway to integrate health data system into the national digital structure for sustainability. Affected system, Janjo.ke for vaccination, Damu.ke for blood collection, KE for TB, Ke for malaria, AHI. I submit.
Honorable Senators will questions. Mandago, have a supplement.
Human. Who were not captured the budget and trainings, public institutions. I want to ask the ministry, what are they doing? Don't get these emergency budgets, results from action or properly budgeted for, so that we are able to for internship effectively move forward planning.
Senator Mazayo.
Thank you, Mr. Speaker, sir, find out from, yes, is it true that on 20th of February this year, the Rural and Urban Private Hospitals Association of Kenya, RUPA, issued a statement suspending the services under SHA, except for emergency cases beginning Monday, 24th of February, 2025. Alleging arrears worth 30 billion. Additionally, the Kenya Association of Private Hospitals, CAP, issued a directive on the 24th of February 2025, resolving to indefinitely suspend all credit arrangements under SHA due to the outstanding NHIF arrears. Now my question would be, what is the government doing to ensure restoration of essential medical services? The second question, as a second question, which is very short, following the suspension of the services under SHA of the two associations, that is RUPA and CAP,
Senator
what
Mazayo.
measures has the ministry?
Senator Mazayo, can we allow the CS to answer the first question so that you can establish actually SHA has been suspended as per your question?
Yes.
And then you can come to the second
I'm most obliged.
question.
I stand
Thank
guided.
you.
I stand guided. I'm most obliged.
Senator Essie.
I had ask, apart from the other alternative causing, appear having goes on how we can get. What if they are we going to watch while every other day I'm reading budgeted corruption in
Senator Essie, I can also answer that question for you because the CS did actually respond to that. You were listening to the response by the Cabinet Secretary.
What she articulated, direct
country.
The first proposal was request for emergency funding, which they have already put to the National Treasury.
So we are having that request. Where then do we need funding to us? We can reorganize our money and sort out our.
Very Let's allow the CS to answer those 3 supplementary questions, then we'll take the other supplementary questions. Yes, Mazayo, Senator Mazayo.
With your kind permission.
Yeah, she's going to respond.
Which sum it up. Whichever way.
Okay,
So,
very well,
then
Mazayo.
I'll be.
Let's save time and go ahead,
Yes.
ask the question.
Yes. Now, following the suspension, Madam CS, following the suspension of services under SHA of the 2 associations, that is RUPA and CAF, what measures has the ministry taken to mitigate the patient in Bamba, which is a very remote area in Kilifi County, be denied medical services which they are fully paying for every month?
Thank you. Cabinet Secretary, if you could respond to those few questions first.
So with regards to Senator Mandago's question, we are finalizing on HRH and interns policy, which again will capture the concerns that have been raised. Additionally, for the question on USAID and what we are doing, we have, as has been said earlier, we have the emergency funding, diplomatic engagement. We are reallocating resources and strengthening our local system, commodity distribution, as well as integrating data system. And again, maybe one thing we forgot to talk about is integration of the various programs that were fragmented into the broader health system. I believe that is one of the areas that we curb, resources that have been leaking. Additionally, partnering with other, member states that would also wish to support, so we are engaging in those levels. With regards to the RUFA, we had given a statement earlier, and yes, we acknowledge the NHIF debt, and we are working, because that is really the highlight or the priority that they are talking about, and so we are looking into a payment plan, and the resolution process is ongoing. But what we want to assure Kenyans is, even this week, 5.1 billion was given the healthcare providers for the social health insurance fund, and this is totaling 18.29 since the rollout in October 2024. And for primary healthcare, we've disbursed 1.3 billion. Again, we are compiling returns from healthcare providers to facilitate the release of the PHC in the second quarter, and to ensure an efficient payment process, as well as we are training the various RUFA, the other facilities on the issue of the PHC reimbursement, the new model, for them to understand why it is a better kind of a model compared to what we had previously. But we are committed to honoring the undisputed NHIF claims, and the finalized NHIF pending claims again are undergoing. We acknowledge that the private hospitals, the RUFA and the CAF are really critical in providing healthcare services, and for us to meet Taifa Care, which is affordable, accessible, quality services to all Kenyans, and we continue meeting and discussing and engaging to see how we can improve services for all Kenyans.
Cabinet Secretary, before you sit down, Cabinet Secretary, there was a second part of by Senator Mazayo on what mitigation measures have been put in place considering the suspension by these 2 associations. to provide services to the people of Bamba. Very well, Senator Mazayo.
Asante Bwana Spika. Bwana Spika, unafanya vizuri sana kuweza kunisaidia hapo. Swala hilo alikuwa bado kulijibu kisawasawa ama kulijibu kabisa.
Ndio nilikuwa nakukumbusha.
Wale ishi wa hiyo rufa na rafu, ikiwa hivi sasa imekataliwa, wizara yako inafanya inachukua hatua gani kwa wale ambao ni watumishi wa hii ambao wanaishi sehemu mbalimbali kama Kilifi? Unavyoelewa ni Kilifi ni kaunti moja katika. Sasa wako wale wanaotumia hiyo ridhaa ambao iko Bamba. Wale watu wa Bamba sasa imekuwa hii haifanyi kazi. Ikiwa ni hivyo, wizara yako imechukua hatua gani kuona ya kwamba wale ambao hawapati services kama hizi wanaweza kuzipata wakiwa huko Bamba, Kilifi County?
Waziri.
Asante sana. So tunajadiliana na Rufa na CAF kuona vile tutaweza kurekebisha mambo ambayo yalikuwa zamani, ndiposa Wakenya wapate sasa hata kutakuwa na wataweza kukutana na PS na hiyo timu ya SHA jadiliana na kuangalia hayo maneno. Tunataka kurekebisha na kutatua haraka sana hiyo maneno. So again, I believe that this is again a time that we need your support, Honorable Speaker, honorable members, in terms of improving our public facilities. What you notice is at the primary healthcare level, the dispensary and the health center facilities are not well equipped in order to improve.
Just a moment, Cabinet Secretary. Yes. Nini hoja yako ya nidhamu?
Speaker pengine anaweza kuwa hajui, lakini ukianza kutamka, ukianza kusema kulingana na kanuni Senate kwamba utatumia lugha moja, kwa vile umeanza kuongea Kiswahili, ingekuwa bora zaidi uendelee kuongea Kiswahili mpaka umalize, sio kuenda ukifika katikati na wacha panda njia unafuata panda njia nyingine. Hiyo Bwana Spika, tunaona kwamba hairuhusiwi katika kanuni zetu, na ingekuwa hivyo.
Senator Mandago, what is your point of order?
Madam Waziri aweze kujibu swali kama hilo.
Mheshimiwa Spika, naomba Senator mwenzangu hayo asawa lugha ya waziri kwa taarifa ambaye anataka kufaidi yeye kwa lile swali ambayo ameuliza. Ya pili, Mheshimiwa Spika, waziri si mmoja wa seneta katika, kwa hivyo kanuni za nyumba hii haifai kwa waziri. Apewe nafasi kujibu swali lilo.
Asante Senator Mandago. Senator Mazayo, hakuna kitu ya kujibu. Senator Mazayo, hatuna muda ya kujibizana. Mpatie mic, mpatie.
Kulingana na kanuni zetu za kudumu, wewe peke yake ndio unaweza kuniuliza mimi, je, ninahitaji kuambiwa kitu chochote na ndugu yangu Mandago kama nilikuwa sikusema kisawa sawa. Kwa hiyo alivyosema yeye, si haki ya yeye kumjibu seneta, hata kama yeye ni mwenyekiti wangu katika hii kamati ya afya, lakini yeye hana ruhusa, hawezi kuvunja sheria za kanuni za kudumu ya hii bunge la Senate. Kwa hiyo Bwana Spika, waziri ni lazima azingatie kwamba yuko katika nyumba hii, na yeye akiwa katika nyumba hii ya Senate, kama kanuni zinasema ni Kiswahili akianza ama ni Kizungu akianza, amalizie hapo akijua kwamba yeye pia yuko chini ya hizi kanuni za kudumu na bunge la Senate.
Asante sana Senator Mazayo. Na nafikiri Senator Mandango alisimama kwa hoja ya nidhamu, si hoja ya kukupatia information. Na alivyosema Mandango, mimi kama mwenyekiti nakubaliana na matamshi yake kwa ajili sheria zetu zinasema seneta akianza kwa lugha moja aendelee na kumaliza kwa lugha moja. Na mimi kama mwenyekiti nilimpatia nafasi waziri kujibu kwa lugha ya Kiswahili na alafu akaendelesha kwa lugha ya Kimombo, ambao niliona kama mwenyekiti iko sawa. So hiyo hoja yako bwana Senator Mazayo tutaweka kando, tuende kwa maswali zingine. Senator Abbas Sheikh Mohamed.
It took a long time, Minority Leader. Honorable Speaker, I think mine is a clarification. Many has been said. One is that according to Shah, they're only paying now currently for the services on the bedding. If somebody admitted, surgeries. By the time somebody goes to ICU, I've not yet started paying. So I wanted to know also on medication. Even when somebody goes to a surgery, definitely somebody has been given medication. Same is not been paid for. And this is the same question my colleague was asking the other time. So when will the ICU payment and medication start for SHA? Because last time we have been told will start around April this year. Is it still on course, or you have done away with it? Two, there's this group called community health promoters. The community health promoters are a very important unit of the medical services. But however, those guys are poorly remunerated. They have no salaries, they're only given allowances. Community health promoters are poorly paid, only get 5,000 allowances. The areas like Wajir and Mandera and Garissa, the area is just so vast. Is there any other plan? Because there's no way of even taking the outreach programs. They cannot be working. You can go by method. So what is the ministry doing, or what the plan is there for health promoters in terms of transportation? Looking into the welfare, especially what they pay, that allows them to pay 5,000 days for 3 months, 4 months. Thank you, Honourable Speaker.
Thank you, Senator Mofaya.
Honourable Speaker, you know we are live. We are streaming live. I've just received a concern from Marimanti Level 4 Hospital, which is in Daraga constituency. I remember, Honourable Speaker, I posed the same question to the predecessor to the current CS concerning the CT scan machine and MRI machine for Marimanti Level 4 Hospital. This question, Honourable Speaker, might not be written and been posed by my fellow senators. So, Honourable Speaker, Marimanti the facility, Honourable Speaker, is the only of its kind part of the Raganidi County that is a part of East. It serves quite a number of huge population across some parts of Maua and some part of Kapani. It's the only facility, Honourable Speaker. I think many people are traveling some far distances to seek MRI services and CT scan. They are going to places like Chuka, to Meru Town, and all far places. I remember this is not the first time, Honourable Speaker, that I've been able to question this matter. So I've just received information from Marimanti now because they are watching us live to get from the CS whether she is aware of those machines that are lacking, and those are very essential for Marimanti Level 4 Hospital in Daraga County. Is the ministry aware that this facility is not having these important machines?
Final question from Senator Joyce Korir.
Yeah, thank you very much, Honourable Speaker. Mine will not be a question, but just to congratulate the CS on a number of few steps that they have made within the ministry. and also encourage her to really find solution to these questions that has been running through the minds of Kenyans in terms of share and Honorable Speaker, and even the issues that she has answered pertaining the contract staffers who have been serving since 2020. Honorable Speaker, I want to say that we should put to an end. The Kenyans are suffering, especially the teachers and our officers who have been stopped from getting the services from a number of hospitals. These are not issues that we need to have a sideshow. We need to sit down. We need to find a lasting solution to these questions. I know the relevant ministries that we have in this country are supposed to guide our executive in terms of making sure whatever we speak is implemented to the letter. So I would want to urge the CS that these things or these stories that is happening within the social media, I want to tell him that there are real issues that are affecting Kenyans. Kenyans are not getting their services. Kenyans cannot be treated. A number of them are suffering in their houses, yet they have paid their monthly dues and they are not getting the access to the medication. So I want to say that it is time for us as Kenyans to up our game and really do what we are intended to do. Thank you.
And we've had additional, we've got to time and their stipend, last one being January. They are paid, have additional 1,000 community kids provision, and we will look into program. Time goes. Regarding the Marmanti Level 4 hospital, under the National Equipment Service Program, I want to assure you that the governor is signed. They again map out and identify what equipment among he requires within the county. That way, this program will support ensuring that we have the various hospitals Marymount. That there is just signing the agreement, then we can tell you, even as we speak right now, have us coming into the country after they had signed some of the countries, some of the Ghana na Bamba. I think ningependa kuambia kuwa wizara ina kufanya watu kuhakikisha kuwa watu watakuwa na hii huduma ya afya, na sasa tunawaambia na pia wataonekana huko. Wizara ina hadi hali wako ama.
What is your question?
I thought maybe I've captioned the response of the CS that we have the machines already installed on the governor who has not signed for them. That the correct record? I can request the governor to come tomorrow and sign for them and Marymount. Is that the position, Honorable CS? The governor is not aware.
Proceed, Cabinet Secretary.
So I want to confirm signed. Now it is work in progress to ensure reach the last mile. Working. Country.
Abbas.
With all due respect, the CS,
This is the same question she avoided to answer for Honorable Shute. That we said SHA is only paying for beds and surgeries. They are not paying for ICU services and medication. And the same time, again, when I asked the same question, she avoided it. Please, with all due respect, I want the Waziri to answer the question. No or yes.
Senator Joyce Korir, what is your point of order?
Okay, thank you very much, Honourable Speaker. Mine was just a clarity that I want from the Minister pertaining the stipends. Can she be able to give us the statistics of every county in terms of payment of stipends? Because a number of counties, including my county, has not paid stipends for the health promoters for the last 1 year. Can we get
Senator
that statistics, please?
I'm sure the CS cannot give you statistics right now. Maybe later. Cabinet Secretary, respond to bus issue, please.
So regarding ICU care, yes, we're able to review benefit package, have incorporated the 20,000, and implementation is upon gazettement. So we increased from the 4,000 to 28,000. In matters of ICU medications and among other services, what we are doing is reviewing the benefit package. Again, we have a benefit package advisory team, which will not only review ICU, but other components that need to be incorporated. As we had said earlier, NHIF did not have ICU. Now we have ICU. And again, we are increasing. And again, we are looking to diagnostic treatment, among others. So what we had started with, the NHIF benefit package. Again, we were looking at the burden of disease in Kenya, which are the common, which are the ones that cause death, which are the ones that cause catastrophe. And that is how we established our benefit package based on the resources we have at hand. But gradually, what we are saying, we will improve the benefit package. And we need to be cognizant of the fact that this is not just a problem of, Kenya. Even other developed countries also face this. UHC is a journey. Gradually, we'll improve the benefit package, and gradually, we want to ensure that Kenyans will be able to access services. For the teachers and police, said that upon registration and contribution of the premiums at 2.75%, then they are able to access the services under the Social Health Authority. Previously, they had an enhanced scheme under NHIF, and that is actually one of the concerns that was...
Thank you, Cabinet Secretary. Thank you very much. Senators, we have to appreciate that the Cabinet Secretary has spent quite a long time with us today. Also, we need to appreciate that has answered the questions to the best of our ability. Cabinet Secretary, I have to mention, I have sat here, many Cabinet Secretaries. I think you have done very well, and you've been very articulate in your answers. Of course, you're not able to answer all the questions in details, but you have made the commitment that you will provide it in writing. We look forward to that. I would want to give you leave now and wish you all the best in your duties. Thank you, Cabinet Secretary. Honorable Senators, now one, therefore stand.